So I'm Phil Kalra, Professor of Renal Medicine here in Salford, and I'd like to just tell you about how research in chronic kidney disease has evolved over the years. We've made great steps forward in terms of finding out more about how we can actually help patients with kidney disease have improved outcomes. However, there are still many unanswered questions. One major one in particular is that we still don't yet know how to predict whether a patient with chronic kidney disease will continually lose their kidney function over time or whether they remain stable. We call losing kidney function over time progression. Now, one way we can do this is to use a cohort of patients. A cohort really means a large group of patients, and there is a study called the Nurture study that involves just such a cohort, and that will involve 3,000 patients recruited in 14 centres in the UK, and we are one of those. The study will only involve 2 visits for you really, and we call it really a light touch study in that you'll be met by a research trials nurse who will take down some details about your medical history, your kidney condition and other conditions, and also ask you a few questionnaires. And you'll then give a blood sample, and the blood sample is then centrifuged, that means spun down, and then separated into lots of different separate specimens, which are then stored in a freezer, first in our hospital and then transferred to a national biobank, which is in Milton Keynes. A key aim of Nurture is to try to see if there are signals which help us find out which of our patients with chronic kidney disease are at greater risk of losing kidney function rapidly compared to those people who remain stable. At the moment, we have only very crude tests that try to help us decide which people are more vulnerable, and certainly using the Nurture study, which involves up to 3,000 people, as I said, across the UK, we will get greater power to determine which people are more at risk. By participating in the Nurture study, your information and your samples will really provide a fantastic resource to help us answer many, many questions, not just now, but years into the future. We will be partnering with different scientific academic groups and also with the pharmaceutical industry, who hopefully will be able to make products to help future patients with kidney disease help their treatments become more appropriate and help slow down the progression of kidney failure.